Hello everyone. We're going to discuss about the objective assessment of integumentary system in today's class. I'm Mrs. Jansi, clinical instructor working at M College of Nursing. At the end of this session, you would be able to perform integumentary system assessment individually, in general, of skin, hair, and nail, and the system-wise assessment. So objective assessment includes skin, hair, and nail. So let's discuss how to do the head-to-toe assessment of integumentary system. Generally, we would first inspect. So it is being categorized into assessment, normal findings, and what are the deviated findings. So in general survey, first you would inspect. So inspect the client for awake, alertness, oriented. Either his or her memory is intact, able to provide you adequate history, and the deviated findings would be confusion and irritability, inability to recollect the information, or lack of information provided, lethargy, or somnolence. Then moving on to the HEENT, which includes head. First, we are going to inspect or palpate. So inspect and palpate the facial movements. You have to identify it is symmetrical or not. If it is symmetrical, then it is a normal finding. If the facial expression and movements often reflect neurological or any psychological disease, for example, if you would observe any pruritus, this may be associated with a deep depression and neurotic excoriations. So you will have to assess the deviated findings for this. Moving on to the neck. When it comes to the neck, the normal findings are no neck vein distension, no unexplained hypertrophy of neck, no palpable or visible cervical nodes, thyroid should not be palpable. So let's find what are the deviated findings. Neck vein distension. For neck vein distension, altered cardiac function that could be reflected with the sinus of skin might be the reason. When it comes to the hypertrophy, in a normal person who lifts weight, otherwise suggests chronic pulmonary disease with potential for sinuses or ruddy skin. When you palpate the neck, sometimes there would be a visible nodes. It might indicate infectious process or malignancy that could cause skin rashes or pruritus. Thyroid. When it comes to thyroid, if it is palpable, hyper or hypothyroidism might be there, both of which can cause integumentary changes. Moving on to the eyes. Normal findings are clear and bright eyes. No lesions or edema should be around the eyes. When it comes to the deviated findings, sclera might be icterus, that is yellow sclera, which indicates jaundice, exophthalmos, that is hypothyroidism with associated skin changes. Next is nose and throat. Nares patent, nasal mucosa is pink in color, no nasal discharge. Oral mucous membrane will be observed pink. That's oral mucous membranes, and the nasal mucosa will be observed pink in color. What are the deviated findings? When it comes to deviated findings, it would be nose and throat would be swollen, red in color. It indicates allergy or infection. So infections such as streptococcal infection or mononucleosis can cause a macular rash. Now moving on to the inspection of skin. So we're going to focus on skin, hair, and nail as told earlier. So now let's inspect skin. What are the normal findings of skin? When you think about skin, there must be a uniformity in color. Okay, uniform skin color with slightly darker on the exposed areas. Ethnic or racial differences account for many variations in the skin color. Mucous membranes and conjunctiva should be pink in color. Note, when assessing for color change in dark skin patients, check the oral mucous membranes. So color changes in the deviated findings, this might be benign or indicate underlying pathology. By inspecting, you will know what is the underlying pathology of a client. Moving on to the second one, that is order. So when it comes to order, there must be no unusual orders. So for this, we need to know what are the deviated findings. That is the unusual orders. What are they? So let's move on to the deviated findings. Unusual body odor, poor hygienic underlying disease. If from poor hygiene may be related to self-care deficit that wants nursing intervention, right? So unusual body odor should be considered. Odors from excessive sweating. If somebody is hyperhidrosis, it might indicate possible thyrotoxicosis. So that should be considered. Third one, odors from night sweats. That might indicate possible tuberculosis. And urine odor. When they urinate, it would smell so badly. So incontinence problem might be the underlying cause. So stale urine odor may be associated with uremia. Mousy odor, that indicates the liver disease. This is all about the odor. Now we'll move on to the lesions. So what are the normal findings? And we will also check through the deviated findings. Then moving on to the normal findings, differentiate primary and secondary lesions. Identify vascular lesions. If the vascular lesions is present, gently palpate and note the blanching and pulsation. And you also should describe A, B, C, D of the suspicious lesions. A indicates asymmetry, B is for the border irregularity, and C is of the color variations, and D indicates a diameter more than 5.5 centimeter. No skin lesions or no vascular lesions should be the normal findings. So let's look into the deviated findings. Classify lesions as a primary or secondary one. First, you need to identify and group it into primary or secondary lesion. So primary is an initial lesion, alteration in the skin, whereas secondary arises from the change in a primary lesion. A thorough description of lesion should include morphological description, that is of size, shape, color, texture, surface, relationship and exudate, tenderness, configuration, location, and the distribution. This all should be considered when you are going to look for the morphological change, that is the description change. For the vascular lesion, also note pulsations and blanching. This is all about the lesions. Moving on to the palpation, we had seen inspection of skin. Now we are moving on to the palpation of skin. So in palpation, first you will know the temperature. For temperature, you will identify the side to side using dorsal aspect of your hand. You would compare side to side. Next, you will check for the warmth skin and then varied depending on the area being assessed. For example, exposed areas may be cooler than the unexposed areas. What are the deviated findings then? When you palpate, you would also feel local area with increased temperature, that is inflammatory because of inflammatory process, infection or burn, which is due to the increased circulation to that particular area. And then generalized increase in temperature, that is fever, local area with decreased temperature, that indicates decreased circulation to that particular area, as with arterial occlusion. Generalized decrease in skin temperature, that is exposure or shock. Second one is moisture. When we look at the moisture, use light palpation to assess the skin moisture. Depends upon the environmental conditions and patient's age. Elderly people have drier skin because of the decreased sweat. And exposed areas are usually drier than unexposed areas. When you check the moisture, you have to look for all the normal findings. And deviated findings would be the increased moisture. Increased moisture includes fever and thyrotoxicosis, whereas decreased moisture includes dehydration, myxedema, and chronic nephritis. Next is the texture. When it comes to texture, use light palpation to assess texture. So varies from soft and fine to coarse and thick, depending on the area which is assessed, and it's also the client's age matters. So exposed skin usually not as soft as unexposed one. Extensor surfaces such as elbows have coarser skin, and usually the younger clients have the softer skin. So infants have the very soft skin. These are the normal findings. When it comes to the texture, as it is normal, now we are going to see the deviated one. In deviated, coarse, thick, dry skin, which indicates hypothyroidism. Skin that becomes more fine textured, which indicates hyperthyroidism. Smooth, thin, shiny skin, it indicates arterial insufficiency. Thick, rough skin indicates venous insufficiency. These are the deviated findings. So we must keep in mind before we check the texture, what are the disease which is underlying? What is the underlying pathology? So what are the disease which I have to look for? That should be in your mind. Next is the turgor. When you palpate, you're going to next palpate for the turgor. So skin turgor. Test turgor gently by pinching a fold of skin on an unexposed area, such as below the clavicle, and note any tenting. Elasticity decreases with age, whereas exposed areas may have less turgor. Turgor is often used to check hydration status. Yes. Next is deviated findings. Decreased turgor or tenting indicates dehydration. Simple as that. It is dehydration and the normal aging. So this might also be seen with the edema. This is about the turgor. So in palpation, we had discussed about temperature, moisture, texture, and turgor. Now we'll move on to the nails. Nails, first you will have to inspect the nails. Inspect the nails for color. Inspect it for color. What are the normal findings? Inspect the nails for color. That is, it might vary from pink in light skin persons to brown in dark skin persons. So color changes in nails may indicate local or systemic problem. So let's discuss what are the different types of nails. Yellow nails, that is mainly seen in a person who is cigarette smoking, who is having the fungal infections and psoriasis. Distal band of reddish pink, brown covering 20% to 60% of the nail. That indicates renal disease or hypoalbuminemia. And blue, that is cyanotic nails with clubbing. That indicates peripheral disease or hypoxia. White nails, that is leukonychia, which indicates trauma for that particular nail. Cardiovascular, liver, or renal disease might be the underlying cause. And black nails. Black nails indicate trauma. Now, let's move on to the shape. First, we would inspect for color. Then we'll go on to the shape. In shape, you will have to first inspect the nail and then have the client place fingers together and note space, that is any opening between the nails. So you will have to ask the person to hold both the index finger together so that you will see the space between the nails. Any nails you can use. If it is index finger of right hand, then it should be index finger of the left hand. So then you will note the space between. So angle of nail attachment, that should be 160 degrees, nail convex. Clubbing is present if the nails meet and angle attachment is 90 degrees. So can you see here? Clubbing. This should be more than 180 degrees or greater. This is early clubbing and this is the late clubbing. So we'll find out the deviated findings. Splinter hemorrhages, bacterial endocarditis or trauma. Angle of the nail attachment, that is 180 degrees or more. Spooning or concave nail, that is called as koilonychia. And ankylosis, pitting, red and inflamed perinoichium, that is paronychia. So this is known as the pitting and paronychia. Next, we'll move on to the palpation of the skin. When it comes to the palpation, first is the texture, and the second one, we will have to look for the capillary refill. So when it comes to the palpation, use light palpation to assess the texture. It must be firm. Longitudinal ridges usually should begin. What are the deviated findings when it comes to the palpation? Soft, boggy nails will be there. That is clubbing caused by poor oxygenation. Brittle nails, which is by hypothyroidism, malnutrition, calcium and iron deficiency, repeated use of harsh nails, contactants or the products. Pitting, that is psoriasis, eczema, alopecia areata. Buse lines, that is the transfer ridges, serious illnesses that can cause nail growth to slow or halt down. This is the texture of the nail. When it comes to the capillary refill, so how will we check the capillary refill? We'll just pinch the tip of the nail, and when you take out, you will find a capillary refill should be less than 2 seconds. So gently press on the nail and note blanching. Then release and note the speed of refill. Yes, how soon the color is reverting back. So poor capillary refill indicates cardiopulmonary problems or anemia under the deviated findings. Now we'll move on to the hair. Hair inspection, that is scalp hair distribution. So in normal findings, it includes inspecting the hair quantity. We'll first inspect the hair quantity and distribution, assess the areas for the pattern. It includes gender, age, genetics affect hair distribution, and hair should be evenly distributed among the head. Whereas deviated findings include generalized hair loss, nutritional deficiencies or side effects of medications, patchy alopecia, which is associated with alopecia areata, trichotillomania, and fungal infections such as tinea capitis. So when it comes to body hair, first is scalp hair. Second one is the body hairs. So body hair distribution. Under body hair distribution, men will usually have more hair on the chest, whereas women will develop hair growth in the pubic region and increase growth on legs and axilla after puberty. What are the deviated findings? Hirsutism. For instance, excess hair growth. Facial or trunk hair would be more. This should be inspected in the hair. Moving on to the color. Inspect the color. Inspect the color. Wide range of normal color variations, gray coloring occurs with aging, localized area of white or gray hair. In patients recovering from alopecia areata and in those with vitiligo and pybaldism, diffuse white hair, that is albinism, green hair, that is copper exposure, and pernicious anemia cases, you would observe green hair. In our country, that is not more common. And condition of the scalp. when it comes to the condition of the scalp, you would inspect the scalp for any lesions, dandruff, pediculosis. Deviated findings include dandruff, seborrhea, psoriasis, certain tinnias, and eczema, that is atopic dermatitis. Moving on to the palpation of the skin. Palpation includes, you should use again light palpation to assess the hair. You should gently do the palpation. Okay, and scalp mobile and non-tender. If it is mobile and non-tender, then that indicates normal findings. Whereas deviated findings includes dry coarse hair, that indicates hypothyroidism. Fine and silky hair indicates hyperthyroidism. Tenderness may indicate a localized infection of the hair and scalp. Okay, now we had discussed about the skin, nails, and hair, how to inspect and what is a normal finding and what is a abnormal or deviated findings. Now we are going to move on to the system-wise assessment. System-wise, what all you should look for. Yes. So let's see respiratory system. Under respiratory system, you're going to inspect, palpate, percuss. Fine. So first thing is respiratory rate within normal limits. Respiratory movements symmetrical and unlabored. Breath sound should be clear without any adventitious sounds. Percussion tones resonant and palpable. Firmitus within the normal range. Whereas deviated findings include tachypnea, asymmetrical or labored respiratory movements that indicates pneumothorax or chronic restrictive lung disease. Crackles, wheeze, rhonchi. You should also observe for the breath sounds. Yes, you should inspect and percuss, auscultate for the dull percussion tones. Okay, from there you can identify the consolidation within the pulmonary tissue, hyperresonant percussion tones and decreased or whether it is absent firmitus. That is emphysemic changes. Chronic cardiopulmonary disease with hypoxia can result in clubbing. This you should observe in the respiratory system. Moving on to the cardiovascular system. First thing you should inspect. Inspect for extremities. Either it is pink in color, warm, and dry. If it is so, then the deviated findings is it will be thin, shiny, hairless, cool skin with decreased pulses. Arterial insufficiency is the underlying pathology. So pulses, no edema would be there. So peripheral edema will be present with lethargic skin observed along with the sinuses and brownish discoloration, which indicates the venous insufficiency. And tachycardia, that is respiratory with impaired oxygenation causing cyanosis. So when you auscultate, you will find both the radical and the apical pulses within the normal limits. But here, when you auscultate, you will find tachycardia and irregular heart rate. Moving on to the GI system. First, you're going to inspect and palpate. Abdomen, whether it is round, soft, non-distended, non-tender, non-organomegaly, and positive bowel sound should be heard when you auscultate. Deviated findings are hepatomegaly. This may cause jaundice and pruritus. Moving on to the reproductive system. Reproductive system, we are going to inspect for external genitalia and any lesions. If it is intact and if there is no lesions and if it is intact, it is a normal finding. In deviated finding, you will find genital rats, that is acuminatum, condylarthrioma, human papilloma virus, HPV, it's otherwise known as. So burning, itching sensation would be there with vesicles. That indicates herpes simplex 2 virus. I think so far we had discussed about all the physical assessment which includes system-wise and the general physical assessment. Musculoskeletal system. This is the last part of our physical examination. So musculoskeletal or neurological, we are going to observe grade 5 muscle strength, no atrophy, sensations should be intact, and deep tendon reflexes should be less or above 2. When it comes to deviated findings, decreased sensation with associated neuropathy will be present, which is increasing the risk for injury to the skin. This is the deviated findings. So before I conclude my topic, I think it is very clear under skin, first the general survey, you have to inspect the skin. And then when you move on for palpation, you should check for the temperature, moisture, texture, and turgor. Then when you come to the nails, you should first inspect and palpate. Inspect for the color and the shape, and palpate for the texture and the capillary refill. When it comes to hair, you're going to first inspect the scalp hair, body hair, color, and condition of the scalp. When it comes to palpation, we will tenderly palpate the area for the distribution of the hair and check for any pediculosis or dandruff. Then moving on to the system wise, we had seen respiratory system, cardiovascular system, GI system, and reproductive musculoskeletal system. Hope you all understood. This is my reference. And thank you. See you in the next class.